As Jamil mentioned, I am Dr. Isabella Angelelli. I am a pediatrician at the Children's Hospital of Pittsburgh. And as a pediatrician, I have also been a witness of the rapid growth of social determinants of health interventions within healthcare. We know that access to good healthcare alone is not enough to be healthy. And within the social determinants of health, we have several domains, one of them being the built environment. The neighborhoods people live in have a major impact on their health and well-being. Within the built environment, trees, the urban forests, are a part of green infrastructure system that delivers multiple functions in cities. The impact of trees on our health and the amount of benefits that trees provide is astonishing. Exposure to trees has been linked to a multitude of positive health outcomes that you can see in this slide. And I'm not listing all of them here, but they range from decreased respiratory illness to improved attention, decreased gun violence, and decreased overall mortality. However, despite all this knowledge, nature is generally missing from social determinant of health interventions generated within our healthcare systems. So this is a great opportunity we have here to bring trees to our communities, a low-cost intervention to cause large impact at a population level and transform the health of the children and people of Pittsburgh. In recent years, the research in this area has advanced tremendously, and the research has become more rigorous, confirming a cause and effect relationship between nature and health. I will share with you the evidence for the link between nature and health in the next few slides. There's a strong connection between air, trees, and respiratory illness, including asthma. Urban trees remove large amounts of air pollution, resulting in improved air quality, and there's plenty of studies and strong scientific evidence to support this. There are also large studies like the one shown here by Gina Lovasi in New York City that show an association between trees and decreased asthma rates. Most of these studies are cross-sectional studies that use logistical regressions, adjustment for confounding factors, and other statistical analysis in their methodology. Obviously, it is very difficult to perform experimental studies in this area. However, I want to mention here the Greenheart study directed by Ted Smith in Louisville, Kentucky. This is a multi-million NIH-funded study where in an experimental study design, groups of people living in certain areas of the city are being assigned to either a no intervention control group or a group which will receive the intervention or the medicine, which in this case will be trees. They will measure a large number of health-related outcomes, and one of them will be the rates of respiratory disease and asthma exacerbations in children. I am really looking forward to seeing the results of this study over the next few years. Now, trees sometimes get negative publicity because pollen released by trees can be a trigger for allergies and asthma exacerbations. However, this is a problem that we have created and a problem that we can solve. Over the past several decades, urban planners have preferentially planted male trees in cities. This is because male trees do not produce fruit or pods and are less messy than female trees. However, male trees are the ones that make pollen, and the combination of pollen and particulate matter pollution in cities is a bad one. As shown in this electron microscopy photograph, particulate matter accumulates on the surface of pollen and can damage the surface of the pollen grain, exposing molecules and changing them in a way that enhances their capacity to trigger allergies once they interact with our immune system. Add to this the fact that heat, increased temperatures, potentiate the interaction between pollen and particulate matter pollution. However, we know that trees clean air pollution and lower temperatures and are therefore part of the solution. But this calls for a concept that needs to be applied when planting trees in urban environments, and that is right tree, right place. Tree planting in urban environments is challenging, and we need to get it right. We need to select trees that produce low amounts of pollen and get the right proportion of male and female trees. Heat waves have detrimental effects on our health. Heat shock, heat exhaustion, dehydration, impaired mental function affect preferentially young children, the elderly, and people with underlying illness. Heat also worsens air quality, worsening respiratory illness. Heat waves are becoming more frequent, and areas of the city where there are more buildings and less trees experience to a greater degree the heat island effect. Those areas are hotter in the summer. underserved areas tend to have less trees and are more affected by heat waves, whereas areas in the city where there are more trees see lower temperatures. Trees lower air and surface temperatures, and increasing tree canopy in urban environments can help diminish the health impact of increasing temperatures. In Pittsburgh, when it rains heavily, the combined rainwater sewage system gets quickly overwhelmed, and sewage water accumulates in our basements and streets and also ends up in our rivers. There are negative health impacts of this, including increased exposure to bacteria, heavy metals, and other pollutants that are carried by the rainwater. In addition, there is a psychological stress from damage to property and infrastructure. Trees are able to capture large amounts of water on their leaves and through the roots and help control the rate of rainwater accumulation on the surface. This way, they can help prevent floods. This is why trees are part of the proposed stormwater green infrastructure plan for the city of Pittsburgh. There is strong evidence from experimental studies showing that trees contribute to decreased crime and gun violence. The group led by Gina South at the University of Pennsylvania Center for Health Initiatives and Behavioral Economics has done elegant and rigorous research demonstrating in urban neighborhoods that vacant lot remediation, which includes carefully selecting trees to be planted, site cleaning, and beautification, results in decreased rates of crime, gun assaults, and burglaries. In addition, people living near the intervention areas experience a 58% reduction in fear of going outside due to safety concerns and a 76% increase of outdoor space. So as a public health issue, we know that the costs of crime and firearm violence in the United States are large and extend beyond the loss of life and emotional burden for affected individuals and families. There are also costs that taxpayer and society end up incurring as a result of violence and gun violence in particular. So vacant lot greening, including tree plantings, is a simple, scalable, and low-cost urban nature intervention and another example of an evidence-based intervention that health systems and cities at large can invest in to promote health. School performance grows on trees, and trees are known to improve education outcomes. There is evidence from observational and experimental studies to support this. Dr. Min Kuo is a former Heinz Award recipient and was with us in Pittsburgh a few years ago sharing her research, which has shown strong associations between greener schools, specifically schools with more trees, and higher test scores. These studies always adjust for a multitude of potential confounding factors, including income and socioeconomic status. And we also know that the greater proximity to the schools, the greater the effect of trees on educational outcomes. So there is a dose correlation with the effect. Experimental studies have shown a cause and effect relationship between exposure to views of nature during class and better exam performance and better learning in nature settings. Exposure to trees and natural environments improve attention scores, and we know that attention is considered a necessary condition for learning. The attention restoration theory helps explain how trees have positive impact on educational outcomes. And finally, there is strong evidence from experimental studies that trees have a positive impact on our mental health. Studies after forest but not urban walks show decreased hostility and depression scores, increased vitality scores, lower levels of cortisol, and cortisol is a hormone that is produced when the body senses conditions of stress. These studies have also shown decreased heart rate and blood pressure after a forest walk, and this is an indication of a state of relaxation. Experimental studies have also shown increased depression remission after regular exposure to nature and trees. So if you think about it, through evolution, humans have spent all of their time living in a natural environment. We have spent an incredibly small amount of time in the highly urbanized and artificial setting that we inhabit today, and which is considered a contributing cause of the stress state in modern people. Our physiological functions have evolved and are adapted to the natural setting, and this speaks to the power of trees to improve our mental health. The evidence is there, as you have already seen. Exposure to trees improves health, and trees have a role in improving health outcomes at a population level. By instance, we humans have known this for thousands of years. We have known about the healing properties of nature and trees. But it is only until recently that we have collected the evidence on this topic. So I would like to invite all of us here to bring to life a collective impact strategy and trust trees. Why would we not try trees? It is time to get serious about trees, and this is my invitation to all of you to see trees and invest on trees as a way to not only contribute to the environment, but a way to improve the health of our citizens.